Hey, hello. My name is Cynthia Rajesh Khanna, and I am the IAGB Youth President. I'm gathered here today with a few of my colleagues to work on this podcast about UMEAD. So before we get into that, I want to make sure that everyone introduces themselves. So could our members introduce themselves?
Hi everyone, I'm Shori Gupta. I'm a rising senior in high school. I love these podcasts. I like to talk about neuroscience, other pressing issues such as cancer awareness. Yeah, I'm happy to do this podcast with everybody.
Hi everyone, I'm Serena Chan. I'm a rising ninth grader and I love talking about science, especially genetics, and I can't wait to do this podcast with you and learn more.
Hi everyone, my name is Nipun Goyle. I'm a rising senior from Franklin, Massachusetts, and I love all things sports, politics, science, and I just love to talk. Let's get started.
All right, thank you. So we are all part of the IAGB Youth Group, like I said, and this is a community-oriented group. We do various projects, community-related, and this podcast is one of them. So now I'd like to welcome our guest speaker. Shazain, would you like to speak about what you're here to talk about?
Hi everyone, I'm Shazain Khan. I'm a freshman at Brown University, although I'm also from Massachusetts. Um, and I will be talking about an organization at Brown called UMEAD, which is tasked with raising awareness about cancer and the increasing cancer epidemic in developing countries, especially with the focus on India, as the founders were from India. Um, and just to explain a little bit about the problem that we see in developing countries, historically, developing countries have suffered from typical Eastern diseases like cholera or malaria or diseases and illnesses like that are typically associated with poor, quote unquote, countries. But now, given that the entire world is starting to industrialize rather quickly, um, it's coming more into light. Diseases such as cancer, diabetes, and more other chronic illnesses that are typically characterized in the West. Now you can see in the East. And India is one of the fastest growing countries in the world and also has one of the fastest growing rates of cancer. And given the recent COVID pandemic, we have seen that there's been both a lack of support and infrastructure supporting cancer patients just because they have cancer, but also those who are suffering from the effects of COVID as well. So it's a really pressing issue that requires an imperative action.
Yeah, totally agree. I think it's super important right now to recognize the effects that it's having, worldwide because it's no longer, just as you said, a quote unquote Western disease. It's reaching all parts of the world. So I think it's great that we have initiatives like Umid that are stepping forward to raise awareness about cancer. I wanted to ask you a question. Why specifically has this westernization led to an increase in cancer and other non-communicable diseases? And why not before?
Yeah, that's a great question. So there's different, and I might not know the exact answer, but there's different potential reasons. One of which is reporting. Um, Before like serious industrialization, there were obviously not really accurate methods of reporting in these countries. So it's very possible that before they suffered from the same rates, it just wasn't reported at the same rates as Western countries reported cancer and diabetes and other non-communicable diseases. The other possibility is with increasing globalization, you see the spreading of industry, you see the spreading of fast food companies, you see the spreading of both positive and negative influences. And a lot of these negative influences in the West, at least, like fast food and other such things, have been implicated in causing cancer and other chronic diseases. And now the developing countries are experiencing and experimenting with these businesses and these globalized industries. You see that they're also witnessing an increase in rates of cancer and other non-communicable diseases as well, especially with diabetes. And I mean, diabetes across South Asia is a real, real problem. We know all the uncles being like, "Oh, I have sugar" or something like that. Like it's a really universally and ubiquitous issue. A lot of these chronic diseases, and so and on top of that, a lot of these fast food and unhealthier alternatives to healthy options are just increasingly adopted because of disparities in class and socioeconomic status, because the unhealthier options are usually the more affordable ones. And so the poor and the lower income classes are forced to, go with that option rather than go with the healthier option, which is less available, causing an increase in cases. But it's a very multifaceted issue that has a lot of potential causes.
Yeah, just a quick follow-up on that. Is it more of like lifestyle, how Western lifestyle has become, more of an implementation in these developing countries, or is it, the spread of diet, or, as you mentioned, those unhealthy fast food places?
Yeah, of course. So I feel like those two go in hand. What part of the quote unquote Western lifestyle is you have this fast food industry that's rooted in capitalist ideals, and that's sort of tainting and sort of I'd say infecting even the more developing countries whose infrastructure isn't as advanced and is more prone to corruption of these influences. And so I feel like those are two things that we can't really distinguish separately and that go hand in hand.
Yeah, Shazain, thanks so much for being here. I had a question more about Umid in general. So I know that having cancer in kind of a developing countries such as India or Pakistan or these other Southeast Asian countries can be also more dangerous because of the lack of infrastructure, as you mentioned, in the hospitals and medical facilities all around. So is there anything Umid is doing to specifically fix that? Or I know you guys talk about researching cancer. What specifically are you guys researching and looking for through this organization?
And that's a great question, Nipun. So Umid is a new organization. It's going to turn 2 years old, I think, come August or September. So it's only been, it hasn't existed for very long. And so we have a lot of plans and we have a lot of hopes and dreams, of course, of where this organization can go in the future. One of which is to become an NGO or a nonprofit at the very least domestically in the United States. But to address your questions, it's definitely a problem of lack of infrastructure in these countries. Me being Pakistani, for example, I know that Shaukat Khanum Hospital is one of the only hospital chains in the entire country that deal exclusively with cancer. And most of the other hospitals in the country don't have the appropriate infrastructure to deal with cancer specifically, despite the fact that it's a growing number of people who have the disease. And in India, it's the same situation, that the infrastructure isn't prepared for this increasing number of just cases of cancer and whatnot. Because if I remember correctly, there's at least 1 million or 10 lakhs cases every year of cancer in India, new cases that is. And so it's a really worrying issue that can't be resolved without serious adjustments to the infrastructure and serious adjustments in the lifestyle. And in terms of research, our organization is more geared towards supporting research. Although right now, what we do is we fundraise for organizations in India primarily right now, but hopefully other developing countries soon. But we fundraise for organizations that are specifically designed to aid cancer patients, especially those who are financially suffering from the disease. And that's becoming even more pertinent given COVID and its financial impact on these families.
Yeah, no, it's definitely becoming much and much more important nowadays to, recognize and contribute to this. So, as a student in the New England area, as we all are students in the New England area, what opportunities do you think we would have to contribute to this? There are non-government organizations. There's organizations like Umid, but what is something that we as high school or college students could do to help this?
Well, a lot of the times it's just as simple as money goes a long way, especially from the West. You'd be very surprised to see how much a dollar from the West can have an impact on low to middle income country like India or Pakistan in terms of cancer care. I believe the number of like just sustaining a cancer patient for like a year in India is around $500, $600. It's not much more than that, and that's for an entire year, and that's an entire year potentially extending someone's life. And so it's a really, in the grand scheme of things, and considering the wealth we have here and the opportunities we have here, it's an incredible opportunity to really extend our own link back to our homelands, because I think that that's an excellent way of connecting back to our roots. And in terms of organizations that also deal with this, to my knowledge, I don't know of any that are specifically in the United States that deal with cancer care in developing countries, but I'm sure that there are those that exist. Umeed is right now trying to partner up with more organizations that have similar missions, especially in developing countries. And we are trying to act as sort of that conduit for different, for those who want to donate to the cause and help bolster this cause. So, I mean, it's definitely a developing field and a developing area of humanitarianism.
Now, is cancer research and the medical field something that you were already pursuing as kind of a major in your career at Brown University, at your education, or was Umeed sort of a passion project that was started on the side and doesn't really have anything to do with what you plan on pursuing in the future?
Sorry, there was just a fly here. Yeah, but I so cognitively, when I think about it, I don't actually have a very close link to cancer. Most of the issues in my family have to do with mental and cognitive issues and deficits like dementia and diabetes, but we really haven't had cancer in my family, thank goodness. But surprisingly, now that I think about it, like I've been involved in like cancer research or cancer care for the better part of my high school and college career. I've been involved. I led the Pennies for Patients fundraiser in my high school, which is on behalf of the Lymphoma and Leukemia Society. And that was pretty fun, but now I'm doing this just more general, like humanitarian focus. And my interest in this is more so having to do with the potential of really like bonding developing countries and like those from developing countries together, because I feel like it's a really important important value of mine to make sure that countries, especially like Pakistan, India, Bangladesh, especially in South Asia, because we're all South Asian, focus more on their similarities and the problems that they all share so that they can pool resources and work together to solve those problems rather than perseverate on the differences and cause even more problems to occur. So that's like more of the general umbrella of like why I'm motivated to do this type of work, because I saw this as an avenue of not only combining my interest in the health field, because I do want to become a doctor, inshallah, and but it's also a way of trying to utilize my skills of trying to bring people together and trying to focus on issues that might not be terribly focused on here in the United States, especially amongst the diaspora.
Yeah, definitely. And do you think the two main issues in South Asia, from what I gathered of you talking earlier, is kind of access and financial aid and the cost of kind of curing cancer and getting to these hospitals?
So that's a great and astute observation. I'd say that one of the pressing issues in South Asia in general, if we're talking about cancer specifically, then yes, it's access to proper management resources, to proper treatment resources, and proper care facilities. But it really isn't specifically just because of cancer. We're focusing on cancer because of it helps synthesize what this sort of double burden of disease that we're seeing across the developing world, with like those traditional Western diseases combining and still impacting with the traditional Eastern diseases. But it's more that there's a general issue with healthcare in South Asia as a whole. There's a lack of adequate healthcare. The insurance system is heavily flawed, where it becomes egregious for people to pay for their care, and basically have very little support from the government, and that the quality of care is pretty terrible as well. I mean, obviously you have these high, like top of the notch institutions in like New Delhi, like Karachi, Mumbai, like even Dhaka maybe, but you don't really have these in the rural areas. And right now we're at this sort of position in our demographic and population development that there's still a lot of people that are left in the rural areas and the less accessible areas, and they need to be taken care of somehow. And so it's less so than just because it is because there is a lack of specific cancer care resources, but it's just a general like manifestation of how the healthcare system needs a lot of work.
Yeah, no, and to pick up on that point of the lack of access, I would assume that and this is the reason why more stage 3 and 4 cases are being diagnosed. You know, that lack of access would lead to those cancer cases developing unknowingly, causing those to be, you know, found out at stage 3 and 4 when they finally get access. And I think this is one of those important points why organizations like Umeed are, you know, important and need to be well aware of you know, their goal. So raising awareness becomes even more important, I think. So yeah, no, definitely, I agree with your point. So one more question: with the U.S. having their, you know, proper development, and, you know, other developed countries having their treatment and cures so far, what is preventing those cures from reaching developing countries like Pakistan, like India, like Bangladesh?
I'd have to put it into one word, and that's capitalism. It's the medical industry is just run by profits and the need to make money. There's also this great selfishness amongst countries in the West, where like we saw it in the COVID pandemic, where they hogged all of the vaccines essentially and left none for the developing countries, and you know, bought way more than they needed. I think Canada bought at least twice of what their population needed. I mean, there was no need for that. So it's both selfishness that's inherent in these governments, but also I think it has roots in like how capitalism has gone like awry and really like overrun with like this need to make profits. And so I feel like it'll be more profitable for companies in the West to sell in the West than in the East, because the East will not be able to afford as many products as the West could. Albeit they produce it in the East because it's cheaper to produce there, but they won't sell it there. So it's really that. It's really less about helping the most people and more about making the most profits at this point. And I think that's a huge, really like huge system with a lot of inertia that it's really hard to change, but needs to change if we're expecting more of a cohesive global economy and a cohesive global health system. Because without that, without collaboration, without at least some sort of element of like camaraderie and caring for others, it's not going to go anywhere. And these low middle income countries are going to continue to suffer, and will be forced to innovate by themselves, which is great. But I mean, people are dying right now, and we have the means across the world to address that. There's a lack of communication.
Now, you talked about the challenges that people face in these countries regarding cancer care. What new challenges or old challenges did the COVID-19 pandemic sort of expose during this time with cancer care for cancer patients, but also doctors in these hospitals studying cancer and treating cancer?
That's an excellent question. So COVID was really like across the world, I'd say COVID was really, unfortunately, was really good at exposing the problems that all of the health systems across our world had and all the flaws that they had. In India, Pakistan specifically, it exposed how the health system there is incapable of really handling large numbers of people, despite these countries having huge populations and huge population densities. And so that infrastructure was basically failing. I mean, if we all remember, like there was a lack of oxygen, like which is a basic supply that you have in hospitals and medical systems, but it was so overwhelmed that they just didn't have the supply. And so people like the cancer patients were already suffering from cancer, and there were some that were suffering from both cancer and COVID. First of all, the ones who were just suffering from cancer couldn't get treated anymore because either A, they couldn't pay for it because COVID imposed some financial burdens on them or their family, or B, the hospital just didn't have room for them anymore and had to make room for COVID patients who were much more pressing matters than cancer patients, because cancer is a chronic disease rather than an acute disease like COVID. So it really was a combination of those different factors that made COVID really this catch-22 for cancer patients. And because of that, it also really exposed a lot of the flaws in the medical system. And I guess that sort of explains some of the old challenges and the new challenges. It sort of like describes like how in the old challenges were just lack of like, I guess, funding of the medical and focus on the health infrastructure, but the new challenges is the inability to multitask different epidemics and whatnot.
Yeah, no, definitely. Along with COVID, do you think, the older diseases, like the older, more known, more prevalent earlier to COVID, like malaria, cholera that you mentioned, do you think those also had an effect on, how doctors were able to treat cancer, at least in the past year and a half?
So I'm not really sure about like those types of diseases. I know that with those types of diseases like yellow fever, dengue, malaria, they're really seasonal. And they like I'm pretty sure dengue in Pakistan at least comes with the monsoon season, and so I'm sure that's the case in India too. But I'm sure that similar to COVID, whenever these cases start to rise, that the cancer patients are some of those that are often disregarded and that aren't really focused on. The problem is that that's like this, and you might be saving like you might be saving a couple of people's lives who have dengue at that moment, but you're ignoring more people who might have cancer, and then that's not even to mention the tens of thousands in the rural areas who might not even know they have cancer and are suffering from that disease, thinking it's something else. And so it's just I feel like in general the health system is incapable of multitasking and being able to handle higher loads of people and being able to give access to larger populations.
So I already know you touched on this before, Shazain, but Umid, I know it's only in Brown University right now. You said it's very new. But could you just touch on one more time some its hopes and futures, hopes and dreams, excuse me, for the near future? Is there any expansion, any connection with other colleges to fundraise, or just more ways to get involved, sort of?
Yeah, great question. So right now our plans are to just continue fundraising at Brown and in the local Brown community, which includes like Massachusetts and Rhode Island and whatnot, and just trying to do outreach in the community and trying to establish those relations, which is why we reached out to IAGB, of course. And so besides that, though, as I said, we want to become a nonprofit and hopefully an NGO. But on top of that, we are thinking of developing sort of this basic infrastructure for clubs in the future that might want to get started in other institutions and even high schools. So we want to make sure that people your age get involved. I mean, I'm not that different from you guys because you're at most 4 years younger than me. But high schoolers are a really, really passionate population, especially in the Northeast and in the United States in general. And I feel like that could help advance this goal very significantly. On top of that, we hope to expand our partnerships with actual cancer foundations in other developing countries as well. Me being from Pakistan, I'm trying to get into contact with Shafat Khanum hospitals, which are the only cancer-related, like major cancer-related hospital chains in the entire country. And so just getting in wider reach will help with like as we get a wider reach here in the United States, that will give us more ability to fundraise even more, which will give us more ability to give that fundraising to even more people in the future. So.
Yeah, no, definitely. I definitely agree that the youth outreach is definitely much more important nowadays, given that, the prevalence of social media and, how connected the youth are. So if there's any other point that you'd like to make, if there's any last point that you would want our audience to go home with, what would that be, Shazain?
I would just wish for people to remember that there are more similarities amongst different South Asians and different groups of people in general than there are differences, and to focus on those similarities so that we can achieve actual strides in whatever it be, in development, in health, and the economy. It requires more collaboration and perseverating on divisions and centuries old disputes that, well, in this case of South Asia, were mostly exacerbated by British people, is, is, is not necessary in this world anymore. It's better to start looking towards, working together. So remember that.
Yeah, that's such a great point to end on. Thank you so much, Shazain, for joining our call today. I hope that we have, raised some more awareness about Umeed, about cancer awareness, and I hope our audience can, do the same, spread the word going forward. But yeah, thanks again for joining us today.
Thank you for having me. Remember to donate.
Yes, we will have a link to the donation in our YouTube description, so you can feel free to check that out. Alrighty. Thanks, everybody.